Hello, my dear listener. Welcome back to Redoctoring. This is the podcast that allows you to be a different kind of doctor. I'm your host, Dr. Diane. Today we have our special guest, Dr. Natasha Lalloo, who I believe truly encompasses what it means to be a different kind of doctor. Natasha is a South African medical doctor who is at the intersection of public health, environmentalism, and also data science. She truly is going to show us how she has redefined her career and how, if anyone is interested in doing the same, what you can apply from her story. How are you doing, Natasha?
Hi, Dan. I'm good, thanks. Yeah, just enjoying the
Thank you.
sunshine. How are you?
Oh, that's good. That's good. I'm doing well. I'm doing well. Thank you so much for joining us.
It's a pleasure. Thank you for having me on.
Let's start with your story back from the beginning. How were you as a teenager? Was medicine something that you always wanted, or how did you find yourself in it?
So, yes, it is something I always wanted to do, but it was more of a situation where it's all I considered. My parents are both doctors, so there was a huge influence from them on me. I very much saw nothing else as prospects, even though I could probably have done many things. It was kind of like a default in my mind, like this is what I want, this is what I will do. So that's how I had got into it. It was all I really wanted, even with my matric trials and my grade 11 trials, my matric exams, everything was just geared to get into med school and do it. But not forgetting that I did actually find great interest in it. Again, maybe from the huge influence, but it is something that really spoke to me as a career. Interested in biology. I loved the life sciences in general. I loved understanding what's going on and what's going wrong and how do we get people to a better state of health. So it was a combination of those two things, the influence and the interest.
Okay, that's quite interesting to hear. It's nice to hear that there was an intrinsic desire as well. Having two parents as doctors, are they both specialists?
Yes, both specialists, pulmonologist and a pediatrician in infectious diseases.
Wow. Okay. Did you also feel like they wanted you to go down the specialist route as well, or were they content with you just being a doctor?
Actually, they for some short time kind of tried to discourage me from medicine, but when they realized that my head was very set on it, they I think would have ideally had me specialize or go as far in my career as possible in that sense.
I see. I see. And then for university, you went to University of Cape Town. Was that where you wanted to be? How did you find that?
Yeah. It was a great experience. I thought the university was really good. The curriculum was amazing. I think student life was great. I had a really good time. Probably too much of a good time, especially at the beginning. But generally, yeah, enjoyable experience. Met a lot of really nice people. Had some really inspiring lecturers and tutors along the way. So overall, it was great. And it also is partly what gave me the idea of public health. I think they taught it pretty well in at least our year. I can't speak for other years, but we had good influence. And I actually remember in fourth year, we had a lecture and it was a little bit about climate change. And I think it planted a seed. So yeah, overall, great experience.
That's so interesting. I've heard also from other people, particularly specialists, that when you enter a particular field, it's because you've had good influence from other people. So it kind of gives you the fuel or the desire to also want to make change in that. With the environmentalism, were you always someone who was like earth conscious and everything, or was it something that you only learned about like in varsity, that you were like, okay, no, us as doctors, we can impact the environment?
So I don't think I've always been earth conscious as a phrase. I think it came, I did have a lot of positive environmental influence as a child. My parents took us camping and hiking very often, but it only truly started taking shape around fourth year when I started going trail running. I took it up as a hobby with some other friends from med school, and it really started helping me connect to nature better. In fact, I started leaving behind road running and getting more and more into this hiking and trail running situation. And over time, that started developing into this like love for nature, this idea of connection with nature. And it only just kept getting stronger. And I started understanding the ideas around how we as people have an impact on the environment and how the environment is actually important to us in so many ways. And much later, the connection between healthcare and public health and in the environment came through. But I think it was a process of connecting the dots, being exposed, coming to love this place, this world that we are in a way different to what many of us usually are exposed to, particularly in an urban environment.
No, that's quite interesting. It's nice how you say that it's something that developed over time. It wasn't a place that you found yourself in immediately. I think for me personally, I've only heard about planetary health when I found you. So it's such a niched um, part of medicine.
Yeah, I guess it is niche, but it's becoming more of a thing. People are hearing about it more. There's more research. Well, the evidence base around it is growing rapidly. In fact, at UCT, me and a colleague, James Earlham, he and I have been with a greater team, have been working on curriculum transformation at the UCT Medical School to incorporate planetary health and sustainable healthcare into the medical and other healthcare curricula. So it's growing, it's becoming known.
If you had to describe it to someone who had no idea and had just come across it, how would you describe what you do?
Well, my job is slightly different to planetary health as a whole. Planetary health, essentially to me, and also partly the actual definition, is a transdisciplinary movement looking at how human activity impacts broader environmental Earth or planetary systems and how that in itself impacts human health. So it's not just as specific as climate change and health, although that is my actual job. It looks at broader things like ocean acidification, land use or changes in land use. How does that impact health? And all the direct and indirect pathways around these things. And also, I should also say that its major focus is that it's a solution orientated field. So it's not just looking at, oh, what are the things that are going on, but how can we actually actively collaborate to solve these things, make the planet better for the environment and the other systems, but also for the humans that inhabit this planet.
Because the environment and us, at the end of the day, we are impacting each other and we have to have a symbiotic relationship. I think that's the word.
Yeah. Yeah. And also, in fact, we are then part of the environment. It's not actually that there's this separation. We're absolutely part of it. And what we do impacts a lot.
I had a previous guest who actually mentioned how public health is actually every sphere of life, how it's transport, how it's, your career, and how it's everything that impacts your health and how your health impacts everything else. So I'm starting to see even how the planetary health is actually even public health, which is cool.
Yeah. Yeah, I totally agree. We talk about the social determinants of health, and the environment is also in there.
You said that you said that planetary health as a whole is becoming more broader. How can you access this information? How can you find more information about it?
There's quite a lot. There's quite a lot being published. I think a few websites could be a useful starting point. For example, the Planetary Health Alliance. That's probably a really good starting point for people. It can give you a good introduction to what it means. There's a little video on the site about planetary health. And then if you wanted to look at publication, the Lancet Rockefeller Commission on Planetary Health would also be a good starting point. It's a bit older. I think it was published somewhere between 2015 and 2020. It's still relevant in many ways, and it's also a really good introduction. Building on that, the Lancet actually publishes quite a lot of interesting articles around this field. So if anyone was interested, they would be able to get a lot from those two starting points.
That's so interesting. I think also just for general knowledge, I think I'm going to go and look into it.
Sure. And maybe a shameless plug, but there's a group called the Women Leaders in Planetary Health. They actually have a very interesting website as well, explaining a lot of things, but they also have a fellowship that's open for applications and it's free. So if anyone was interested, they could also look there.
Yeah, that's definitely cool. Are they on LinkedIn or is it a LinkedIn group, a Facebook group?
They have LinkedIn, but it's also a website.
Let's go back to your time in UCT. I thought something that was so interesting that I saw on your LinkedIn was that you did your elective in research at the Columbia University. That's so cool.
It was a very cool experience. It was me and my longtime friend and colleague, Darshnika. She and I both undertook this research elective there. It was a really interesting experience. So we got this whole idea through the public health. There's a research institute within that works with the research institute in KZN that my parents were part of. So they got us that connection. We managed to get a part to play within a broader study. And yeah, it was just a wonderful experience. We learned a lot. We got exposed to a lot of different parts of public health, which I think was probably the best part of that experience. Not just the actual research we conducted, but just seeing all the different types of projects that people are doing around the world. People were doing so much research in South Africa as well. And I don't think we totally in medical school understood or recognized how broad that whole situation is, where like a lot of the world finds South Africa very interesting. We have a lot of things going on, and so a lot of research is focused here. And just to get that both global and also South African broadening experience was really cool. I thought that was part of planting the seed, or at least watering the seed that was already planted.
Didn't know you could do your elective in research, so that's actually quite cool.
Yeah, I wonder if it's still the same. At least back then you had the option of a clinical rotation, elective, or a research elective, in which case you could conduct that anywhere.
Okay, no, I see. Would you say that that experience ignited a curiosity for the non-clinical route, or was that something that developed later on?
It did. It didn't yet evolve into anything specific, but it definitely sparked the interest or knowledge that this existed.
Exposure is definitely important. And I think the fact that you had that as a medical student, that's so important. And unfortunately, because medical school is so focused on the clinical skills, sometimes you miss out on the other aspects of showing what a doctor can be. So it's quite cool that you found that out already as a medical student.
Definitely. Yeah.
So you did your internship at King Edward and then your community service at Tonga. How were those experiences on you mentally?
Internship at King Edward. This is a hospital in Durban. That was also a great experience. Very intense. I started off with the surgery block. It was a thing. It was extremely tough, and it was in summer. So it was just a lot of running around, being hot and sweaty, and doing long hours, lots of patients. It was also intense to have started internship. You know, you're fresh out of med school, and here you are thrown into the deep end. It's very intense. Things got less intense as time went on. You know, you're more familiar with the structures. You're more confident in yourself as well. But also, none of the blocks seemed to have been as hard as surgery. So it definitely got better. Thereafter, it became a really, really great experience. Met a lot of really nice people, both as intern colleagues, but also seniors, also patients and nurses. So overall, lovely experience. Hospital was going through a lot at the time as well. Towards the end of my internship, we had a massive flood in Durban, and it sort of ruined parts of the hospital, both King Edward and Wentworth, where we did some of our rotations. And yeah, that was quite a significant, visible, tangible impact of climate change on the healthcare system.
I remember the other day I went to a specialist dinner, and the one doctor gave a talk about how, us as doctors, we actually don't think about how much plastic we use. Like in the syringes and you open multiple syringes and you don't necessarily need all those multiple syringes, but we never think beyond what is happening here.
Yeah, absolutely. And I'm glad you raised that particular point about the waste. I think we don't always connect the dots as students and maybe even as we practice, but with time you start to realize, okay, in my career so far, I've used so many unneeded needles and syringes and test tube bottles and papers and stacks and stacks and stacks of papers that you start wondering, okay, what is actually my individual impact in all this? And then as a whole, what is the system's impact on the environment? I think if it's taught in medical school as a good starting place, perhaps it can have the impact of making people at least consider or be more mindful in their way of practicing. I don't think it's necessary for everybody to go into climate health research or whatever. I think it's more a situation of if everybody was mindful about, okay, if I prescribe this, these are the carbon impacts of this because we have done, or not just carbon, but environmental impacts because everything creates some form of pollution, the production of medication, the packaging that it comes in. Something as simple as that. Do I definitely need to prescribe this medication? And then going back a bit, do I definitely need to run this test? We need to have this all at the back of our minds in actually doing things. It's not just cost saving, but it's also carbon and pollution saving. And so I think that's one way to get climate change or planetary health into people's minds. But also, I think it needs to be taught in different, more clinically relevant ways in terms of as the climate changes and as the systems we find ourselves in change, our patients' circumstances will also change. And perhaps someone who wasn't at risk of heat stroke now maybe actually at high risk of heat stroke, and different people have different vulnerabilities. So as a clinician, you need to bear these things in mind as you manage a specific condition, for example, diabetes or renal disease. Or if you have an elderly patient, you have to understand how to advise them. Okay, it's about we might have a heat wave soon. You might not actually be able to come to this facility to get your meds. And in fact, if you do try, you might be exposed to such severe heat that you could get heat stroke. And, it's things like that that we need to bear in mind as we practice. If we have pregnant women who are patients, we need to know that that in itself presents different vulnerabilities to heat. And I'm only speaking about heat. There's so many other things. There's flooding that puts people at risk in various ways. It's access to clean water. It's waterborne and water wash diseases that become a problem. It's literal physical access to healthcare systems. For example, that flooding that we had in Durban, a lot of roads were closed, ambulances couldn't move, so people couldn't get to the healthcare facility urgently. So it's all these things we need to keep in our minds as clinicians as well. Not just I need to be mindful about the waste that I'm producing, but also I need to understand that these systems affect the patient and the patients in my ward. So yeah, that's something I think should be brought into the medical curriculum. And definitely we need to start thinking around how surgery, for example, can be more sustainable, not just surgery, but a lot of others. But as an example, surgery, like do we definitely need to do this particular procedure? What is the waste involved? Is there a way to do this with less waste? Is it possible to reuse instead of getting a single-use item and discarding it, etc.? So it's a lot of things.
It's very broad, but also it feels like it's a whole ecosystem of knowledge that we don't think about impact with regards to patients. We're so interested in the life that is in front of us and
Yeah.
how to physically save that life with either our interventions or our medicine. But we don't think about how that patient is going to go into the environment and actually live in that environment and how that will then impact their health. So it's such a good chain of events that you have to think about.
Yeah.
With
Totally.
regards to your day-to-day as a research clinician in climate health, how does that look like?
So I work remotely, which I think is an amazing thing for a medical doctor. It's my favorite part of this job, that I sleep in my own bed. I have full control of my day. It's really nice. But my day-to-day is essentially a combination of meetings and actual work. Seeing as we're remote, meetings are always online, and it's a really great place and time to connect with the team and get a grip on what we're doing, where we're headed with a particular project, what work each individual needs to do, or who needs to team up and do some specific work. Sometimes the meetings are actually getting certain types of work done. For example, someone is running, at the moment, we're running an analysis on a massive heat health data set. Someone's trying to work through the actual steps in this analysis, and a lot of us are reviewing it and observing the process from a few different perspectives. Like, does this make sense from a physiology point of view? As a doctor, I think we should look at temperatures at this point because perhaps that has more impact on the body's metabolic processes. Just as a small example of how that works. Yeah, so that's basically meetings, and then actual work. You're doing you're just doing your general work. Whether you're writing something up or you're reviewing something, you're doing some form of analysis, whatever it may be. That's kind of how my days look. Yeah.
That's so cool. You are a remote worker doctor. That is so unheard of, but
Yeah.
I love it. Wow. So now with overtime, do you have overtime?
No. Unfortunately, that's the other side of it. There's no overtime. You don't get the same pay as a clinical doctor, but that's okay. I mean, I get to surf in my lunch break, and that's fine.
That is so cool. Oh my goodness. I remember last year, I did my community service in ICU, and there were such hard days that I was like, you know what? I need to find how to be a remote doctor. Because if I can be a remote doctor, then I can have a better quality of life. It's actually a conversation that a lot of doctors are having these days, which is fair.
Yeah, and in fact, that's it highlights quite a thing about doctors as humans. We don't have enough of that space to be ourselves, to have control of our days, and to, just have a weekend where you don't have to be at work, or like, you can do something whilst doing some work. And it's a problem with our system, and also a small part of what drove me away from clinical work.
Some people, when they step into the non-clinical space with regards to medicine, they feel less than as a doctor. Is that something that you also felt?
Yes, I think most of us feel this. It's a self projection or an idea that other people are thinking that we're less, but it's also this personal feeling of, am I letting myself down? Am I letting go? Or am I putting to waste all these years of medical school, internship, ComServe, etc.? So you do grapple with these things. Also, some people do actually think less of you as a doctor. So you do have to deal with a lot of these things for sure. Yeah.
I found that instead of looking at it as grieving the identity of a doctor, it's more about focusing on the transformation of a doctor in your life. And I think that's a better way to look at it so that you don't crash out or anything.
Yeah, I love that. It's not, I think, despite what people think or feel and how you may think or feel about it, 100% it's a transformation and you're not any less of a person. You are simply exploring different avenues and different parts of who you are. I don't believe in this idea that we have to be boxed into one thing. I think people have so much to offer to the world in so many different ways that if you just leverage your different skill sets, you can be so much more. And it's such an eye-opening, liberating experience when you let go of this notion that you have to be, now that you've studied medicine, you have to stay in this, or that you're any less of a doctor just by stepping out of that. I think it's brave and it's liberating.
It definitely is. And it's why stories like yours are so important. Can you imagine back in the day, you could never see a remote worker doctor, but now we have representation of that. So it is possible for someone to aspire to do that.
Exactly. Yeah, exactly. And if I can help anybody, I mean, everyone's career path is totally different. But if I could help anybody in not feeling alone and understanding that this is an uncharted terrain, it's okay to feel a bit confused, stuck, etc. But just, other people have done it and it's possible and it's totally worth it.
Definitely, definitely. You mentioned previously with regards to getting your research elective, how networking helped you know someone in the space in order for you to be able to do that. Have you seen networking play a lot
Mm,
more roles and give you a lot more opportunities in the space that you're in now?
absolutely. So it's these are uncharted terrains to navigate, but on the other hand, there are people who have done these things, and it's still early days for this particular field, but it's growing so rapidly that there are people doing things. And I mentioned my friend and now colleague Doshnika. She's working for the organization that I work at now, and it was through her that I actually was discovered by the organization. She put me forward as a potential employee, and they took it and ran with it. I had an interview, and that's pretty much how I got to where I am right now. So that's a great example of networking. But also further than that, or more broadly than that, in my previous job, I worked with some people from some really amazing organizations within South Africa. I think has helped us with my current job in networking in terms of finding other collaborators for a specific project that we want to embark on that is quite broad and quite large. So it's been useful to like be known by that person already. So yeah, it plays out in so many different ways. And I think, yes, it's helped me get my job, but it also helps within the job.
I think as doctors, we underplay how necessary it actually is, how crucial it is to have someone know your name, to bring you into spaces. So it's something that we definitely need to be focusing on.
Yeah, I think many doctors will be Oh, for sure. Sorry for interrupting you, but yeah, many doctors don't even want to have a LinkedIn profile. So yeah.
Which is crazy. It's so easy to update. It's so easy to put something. And also, I read the other day, they said that LinkedIn, you also need to be someone who engages with the content, repost, post things. But that's also a conversation for another day, how LinkedIn is now it's a professional social media account. Okay, let's pivot into you were a Chevening Scholar recipient, which is crazy. That's so good. Congratulations on that. And then
Thank
you
you.
went to London. What was your process with regards to acquiring the scholarship?
Thank you. Yeah, it was a thing to get it. So maybe to just step back a little bit, I post ComServe didn't really know what to do. I knew that I wanted to travel, which I did, but during that time I wasn't sure what direction I wanted to take my career in, and kept thinking maybe anesthetics, maybe pediatrics. I love working with kids, but couldn't really totally see myself doing these things. And also in the process, I had at the back of my mind and growing bigger was this thought about, the environment. Something you're passionate about. You've been growing in this space of environmentalism and learning about, human impacts and how we can take steps to do something about it. And then on the other hand, you want to be a pediatrician, which you treat children, and then what kind of context do they go back into? Is this a world that's actually going to foster their health in a positive, constructive way? So these thoughts all kind of were bumping around in my head, and that was growing larger and larger. And a friend was like, okay, I've done this Masters of Public Health, or I'm doing this Masters of Public Health in London, and you should actually look into it. This particular school has a Center for Climate Change and Planetary Health, and in fact, it might be quite appropriate for you. So I looked into it and I thought, wow, okay, this is a really interesting way to bring my clinical medicine passion into or together with my environmentalism into public health. Like, this is perfect. So I looked a bit deeper into it and realized, yep, this is something I think I should pursue. I applied. I got the university place, but I didn't get the scholarship the first time. Got through to the interviews. Unfortunately, it was a combination of not having had an interview before, because as doctors, we do not get interviewed. We just kind of go into a space, get asked about a bunch of clinical things, and then get given the job or not. So that was one thing. But the other thing was it was also during COVID. I was very stressed. Everybody was stressed. This was the first time this interview was being held online. It was chaos. I was not in a good space. So unsurprisingly, I did not get that scholarship. But I also think maybe I wasn't ready. I probably didn't have enough under my belt just yet. So I deferred my university spot and waited to reapply. And in the interim, I did a few other things. I was starting to work in the public health setting, or at least starting to veer outside of clinical medicine. I was doing a combination of locum work, but also working on a public health project, which was looking at tuberculosis in the mining sector and how to create this like region-wide logistical data system to trace contacts of migratory mine workers. So that was my first foray into public health, you could say. And then shortly after COVID hit, that project got canned and I started moving into this clinical research space. So it was sort of an interim thing where I was still exploring and learning and figuring out. But then I found this clinical research post and I thought, wow, okay, I can do this. And so I did this for a while and it's interesting. It's a good learning curve, great experience. I also got to manage and lead a clinical team within this organization. But in the end, that kind of work can get repetitive, or at least for me, it got a bit repetitive. So the learning curve definitely plateaus at a point, and so did my interest. So fortunately, I got the scholarship from that point. I had now had a lot more experience outside of actually just doing medicine, but also in a leadership position, which is one of the key qualities of the Chevening scholarship, is they're looking for leaders. And I think by the time I got to the second interview, I was much more confident, but also capable as a leader. And I think that really helped push me over the line to actually get the scholarship the second time around. So that was a really great experience to like learn about myself, see what kinds of things I needed to be better to get the scholarship. And it wasn't just the process of I'm doing this just for the scholarship, but it was also just for me as a person. So yeah, it was not easy, but it happened
Mm.
and I'm very glad about it.
Definitely. Besides leadership, which you mentioned, what other traits do you think makes you stand out with regards to applying for Chevening?
So there's, I need to remember correctly, but there's I think four key qualities. There's the leadership, there's the networking, which we've sort of covered already. And then there's also like, how will this actually impact your career, and what do you see for yourself going forward in terms of using this master's? And yeah, sorry, can we go back to the question again?
No problem. I just wanted to know the qualities besides leadership. What else makes you stand out as an applicant?
Yeah, so I guess more within leadership, the whole idea of taking this novel field forward in South Africa. I don't think climate and health has really been a conversation point in the country. So I think that really set me apart from many other medical doctors going into public health. And I had a vision, I wanted to lead the space, or at least bring the space and open it up for people so that not only can we learn more, but also we can start implementing solutions. And one of the parts of my application was saying I wanted to leverage the networking of people that I meet to actually begin to solve problems. And in fact, that has been a thing. Someone that I did the scholarship with in my cohort is now going to be part, or at least through an organization, where she's going to collaborate with us next year. So yeah, it was little things like that, having a strong vision for how this work is going to be useful for you and your country, and how you actually will benefit from it, as opposed to just giving it to anybody else, or just doing this back home in South Africa at your own university.
It sounds very impact focused. If you have a strong vision, a strong why, that is something that will put you apart.
Yeah, definitely.
Do you have a strong moral why as to what keeps you going in the field that you're in?
I think, yes, it's a lot to unpack, but I am generally someone who sticks very much to my principles and morals and values. I can be unwavering, but I am open to understanding other perspectives and changing accordingly if it fits and works. But basically, very principle driven. And one of my own personal principles or values is, we need to treat every living being well, or as well as we can. And that guides me quite strongly. Yeah, I think just having that has motivated me and pushed me through a lot of my work. It keeps me grounded. It keeps me like, okay, is this the right thing to do? Does this follow like social justice principles? Does this benefit people? Does this harm anyone? Should we maybe not do that? Yeah, so that I think that guides me quite strongly. And I also have this vision for, a world where we all are able to access our potential. So not everybody would follow a specific path, but it should be that we all can. Yeah, that's I guess one of the main guiding principles that take me through my job and my daily life.
Yeah, that's so cool to hear. I think I really resonate with the part where you mentioned about treating each human being well. Sometimes it's hard to see what impact you're having, but if you zone in and you focus on the one that is in front of you, then it can help you feel a lot more better as you push through.
Yeah. And I personally extend that not just to people, but every being.
So let's bring the plane down. Let's land the plane. With regards to your LinkedIn profile, what's a fun fact about you that might not be visible there, but like it's something about you?
I did think about this. Probably that I am very outdoor driven, but also I go to the gym a lot. Kind of probably conflicting things.
I think it speaks to caring. The one is
Maybe.
caring in the environment and the other is caring about yourself. So that's actually quite cool.
That's a good point. Thanks for that perspective. But yeah, actually, I agree.
So now to close up the episode, where can the people find you if they want to hear more about you and to engage more with climate health, planetary health, all those good things?
Yeah, I mean, you can drop me a message on LinkedIn. I'm very open to that. I might not connect if I don't recognize your name, so rather message me. Yeah, that's probably the best starting point.
And one last thing, is there anything that we didn't talk about that you feel like would help someone who is curious about this field?
Probably just talk to people who are not in medicine, who are not in a clinical space. Talk to people outside of that and get a feeling of how it is. I think anyone who is questioning or has an interest outside of medicine doesn't always have a person to talk to about these things. So I think just finding someone really helps. It's important to question. And in the end, even if it leads you back to clinical medicine, I think you would feel more at peace with that as opposed to just following that straight trajectory that has already been predetermined and wondering always, like, is there something better out there? I think questioning, finding someone to talk to, and following through, being brave. We tend as doctors to not even realize that we have so many awesome, interesting skills, from people skills to like practical skills, the way we think, the way we approach the world, so useful to so many different fields. And we just have to leverage that. We just have to understand what we actually have to offer that isn't just pure clinical, but uses those skills. And also, like, we can build on them.
That's definitely beautiful. Thank you so much for sharing that.
A pleasure. And thank you for having me on. I hope this has been useful.
Definitely. I think even if it's just impactful to one person, that's enough. That's enough.
Yeah, that's true.
My name is Dr. Diane, and this has been Redoctoring, your permission to be a different kind of doctor. Please do comment, like, subscribe, all those good things on whatever platform you're listening to this on. Follow our Instagram, TikTok, and also YouTube page. Bye.